Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. Joining me today is Lisa Rosenberry. So Lisa runs our mobile health and cancer unit. So Lisa, I know this spring you've been doing a lot of things. So tell me a little bit about what you're doing.
We are basically ready to launch. So June 12th will be our first event. We are going to be focusing on the uninsured. And then the following week, after all the testing is done, moving into some insured folks like Medicaid, Medicare, commercial insurance. And really, we are just so excited to get out into the community and bring the services to the people.
Tell me a little bit about this mobile unit.
This unit has been the dream, I would say, for us at NJ CEED, and then a separate dream of Dr. Kramer to really look at our model of always kind of wanting patients to come to us. And we had a lot of, what I would say, no-show rates. And we realized we had to do something different. And we just felt that bringing a unit to the people was a way to kind of combat that and really make it as easy for them as possible.
You mentioned NJ CEED. A lot of people may be unfamiliar with that. What is it?
You're right. It's called Cancer Education Early Detection. We are funded through the New Jersey Department of Health to provide free cancer screening to men and women without insurance.
So this unit, as well as others, by design, are to help deal with health equity and some of the social determinants of health?
100%. I think health equity and removing barriers to care is really what we are all about at New Jersey CEED, and then larger now in our mobile health and cancer screening unit. We are really going to be providing an avenue to that we turn no woman away. That was really what was happening with NJ CEED. If a woman came with Medicaid, because we are grant funded for uninsured only, we had to turn them away. And that was starting to kind of weigh on us that here we have this able person that's here ready to go and we can't do anything for them. So that's really what led us to bring this decision to the foundation to see if they would be willing to back us up, and they did.
So this is not a new service. So we've had a mobile unit, and if I recall, we were doing roughly about 700 mammograms a year, or is that number correct or incorrect? And what do you anticipate this new mobile unit will allow us to do?
You've done your homework, I'll say that. So Lackawanna was a company we contracted with. Virtua never owned our own mobile unit. So we were really at the mercy of them to compete with other people in the Northeast region for dates, times, locations. And we had a max of patients we were able to see. And now with Virtua owning our own mobile health and cancer screening unit, we set the tone for that. We can be in the community as much as we want. We're planning on being in community 4 days a week, 3 days focusing on insurance, 1 day uninsured. We'll be in various areas between Burlington, Camden, and parts of Gloucester County.
So we'll be in various areas, but what type of places will we actually be at?
You name it, we'll be there, whether it's a church, whether it's a business, whether it's a civic center, whether it's a bunch of neighbors that say, hey, we have 20 neighbors that we're ready to go. We will go wherever it takes, as long as we can clear that 40-foot bus through a location.
How will people even know that we have this service to provide?
So right now we're building it on the website. So I think it's already on Virtua's website. We're running a host site model, which we've found based on research from other mobile units across the country is the best way to go about it, which is essentially a host site provides that they will provide for 20 mammograms. They give us the names. We help them register in advance. And then we show up at that location and get those people through. We'll be offering kind of a one-stop shop. So a patient can come and they can get a mammogram. They can get their pap smear. They could be offered a GI appointment or a fit card to mail in if they don't want to do a colonoscopy, as well as their mammography. So we're really just trying to get it all in one-stop shop.
So tell me a little bit about you. So clearly you didn't just wake up one morning and say, you know what, I want to run a mobile health unit. How and what in your background sort of led you to today?
I have a very varied background. So I am a licensed clinical social worker. So I'm a therapist actually by trade, but I've also have done community mental health for years. So I have just kind of been in the heart of people that, struggle and whether it's with mental health, whether it's financial resources, and just there's never seems to be enough that we could do. And, you know, and then I was able to transfer into the medical field, but still keep those tenets of social work. And instead of working kind of with that one-on-one individual where I was doing with when I was part of the social work team here, now I'm able to do it for a whole bunch of people and continue to make a difference.
Our mission is to help people be well, get well, and stay well. And one of the ways we do that is through our mobile fleet, because as you mentioned, we're trying to get to those folks that might not otherwise have access to this kinds of care. Our mobile fleet, we have a number of units, a mobile grocery store, mobile farmers market, and pediatric unit, and they all have names. And so have you guys started to think about this new unit and what he or she may be referred to?
Whether it's fortunate or unfortunate, I'm not sure. But yes, names have been thrown around. The name that seems to be leading from our driver is Beyonce.
I don't know if Queen Bee would appreciate having her name on the side of a bus.
You know, we could just refer to it as that, or maybe it'll go viral. Who knows? Maybe she'll support our mission. That would be awesome.
And maybe after we air this segment, someone out in the virtual universe will send us some potential names.
We are definitely open to that, you know, and it's awesome to work for an organization that really believes in the community and is willing to not just say it, but do something about it. So I appreciate what you've done for us here.
I do think this is an exciting program. I am so excited to have it as part of our fleet as we address health equities. And I'm really appreciative of the fact that this is a calling that you have taken on. And thank you for taking the time to share the story with me here today.
My pleasure. Thank you for giving me the opportunity.
Thanks for joining us on Inside Edition of Here for Good. We look forward to bringing new and exciting stories about your fellow colleagues as we move forward. So thanks for joining us.